Mr. John Mahmood, Security Manager and MC Delta, all managers, all section heads, guests, ladies and gentlemen, a very good morning to you. Our program of today is Cancer Awareness Day, which is under the theme, no one should face cancer alone. As you have seen the two ribbons, we have pink ribbon and we have blue ribbon. The pink ribbon is for breast cancer and the blue ribbon is for prostate cancer. So the talk of today will be on breast and prostate cancer. Not to waste time, allow me to welcome a very important person, a person who our safety is in her hands. We need to feel safe in this hall. Please allow me to welcome Madam Tina Kaskia, Safety Section Heads, to come and give us safety briefing. Madam Tina, you are very welcome.
Thank you, the Master of the Master. Thank you, our Master for celebrating for wonderful interactions. Good morning, ladies and gentlemen. My name is Tina Garcia. I'm a safety section of Florida. Allow me to take you to the important safety briefing. Our objective for this briefing are as follows. Number one, to ensure timely and effective evaluation of all employees. Number two, timely zero emergency incidents. Number three, safe movement of the reports. Number two, timely zero emergency in accidents. Number three, safe movement of the people. Number four, communication of the necessary action to be taken. In case of an emergency, you have to follow the 10 instructions. Number one, you have to stop immediately and then evacuate the building. Number two, don't delay your exit from the building. Number three, don't delay and complain and follow the instructions. Number four, you have to be familiar with the exit signs. In case of an emergency, you have here three exits. Number one is here in the left side, and then number two in the dark corners, and then number three on this side. In case of an emergency, we have to use those exits. And then we do not allow to use elevator. We have to use only the stairs. In this in an emergency, we have to go from here, from here to this one, and then we will meet in our assembly point for the head count. And then you are not allowed to return to waiting. You have to wait until you wait to instruction from the safety means. Number 10, and then the last, you have to pay obedience for the all safety signs. Here I conclude by allowing you to listen for those alarms. Here we have the two alarms. We have number one, the fire alarm. The fire alarm that is meant for the slow evacuation only. This one is in case of an earthquake, and then this one can be limit. Or you can skip the slow, and then can be easy to control. That means if you have a fire in the ground floor, you have to only evacuate the ground floor. You cannot need to evacuate the second floors. And then we have number two. You have to listen for those alarms. This one is the fire alarm. And then this fire alarm is meant for the floor evacuation only. This one can be highly specific for the floor and can easily controlled. And then number two is evacuation alarm.
Good morning. Please evacuate by the nearest existing staircase and obey all instructions given by the fire orders. Remember to avoid the use of police.
fire victims. And then this one is response for the bigger hazard order. We have a bigger danger and the place. And then this one is the request immediately evacuation for the entire building. And then this, for example, if you have a bigger fire, you release the police alarm, and then you have to evacuate immediately. Thank you.
Thank you, Madam Gino. As it's my pleasure to introduce our acting manager. He's someone who has been instrumental in guiding our team toward the success of our project. Please join me in giving a warm welcome to Mr. Paul Ogali, welcoming remarks.
Let me begin by thanking the protocol today, and I begin with recognizing the presence of our MC members in the presence of John Mahmoud, the executive manager, Dr. Isaac, who is our guest of honor this morning, managers, colleagues, you are highly welcome to this very important event. A lot has gone into this that we are seeing today. The colorful hallway today. This is as a result of a lot of contribution from our colleagues from the health section and the Dpoc Women Group. And please join me in giving a round of applause to this group for the work they have done. And this day would not have been possible without the support and commitment of our MC and the senior management of Dpoc. So please let us also give them a round of applause for their time to be with us. So what activities they do, but we thank them for coming. I know we're supposed to have guests from Itero, we're supposed to have guests from we're supposed to have some guests from the Federal Republic of Egypt, Indonesia, and they're here with us, doctors. They were coming, and we're supposed to have some team members from the Tobiar Center. Are they here? Thank you for being with us. We appreciate your presence. Without wasting so much time, this day, where we are going to go through awareness, cancer awareness, we all, as individuals, as groups, as families, we all experience cancer incidences, cancer trauma, cancer mortality. We've all gone through expenses that we have put to treat those among us who have succumbed to cancer. Therefore, it is important that we take this awareness program very seriously. And I guess what will be going to the issue of the age factor when it comes to cancer. I can see some of us here are actually 45 plus, if I'm not mistaken, 45 plus. How many of us are 45 plus here, Jama? 45 plus, don't be shy, 45 plus. For those of us who are 45 plus, we must know that we are already in the year of work. And therefore, it is important for us to consider the way we live, to consider going for early screening. You're most welcome. I think these are our guests from the Republic of Egypt. You're most welcome, progress. Please do this. So I was saying, as we advance in age, we are supposed to watch out and consider early pregnancy screening. Somehow, one of the issues that is always hampering us is the nature of our perception about cancer. So we have devised for ourselves some sort of barriers. Yeah. Knowing that it is important to carry out the screening, we still don't want to go for screening. And this is mainly because we have a lot of questions in the back of our minds, a lot of doubts. You know? We think that when you are diagnosed and your cancer results are positive, we think outright that it is going to be mortality. This is how we think. But that is not usually the case. We ought to be positive. We ought to live a healthy and happy life. But how to do it, what to do, is the very essence. We have these doctors here with us. We're supposed to expect them to give us comfort and to prepare us mentally and spiritually with the facts and lessons that others have learned, so that we can also continue to care for those who are dying with cancer. There's going to be a question and answer session, and I kindly encourage that we engage during that time, because it will help us to eliminate some of the stigma, some of the cultural barriers, and some of these deep-seated impediments that is holding us back from facing cancer. And we know cancer is an incident, and it is manageable through early screening. And therefore, there is no time for us to wait until we begin to experience the symptoms. It's always good to go for early screening. As agency, as Dpoc, we have expectations. One is that by the end of this program, we will have a different mindset about cancer, so that we can save our lives, and so that we can care for those who have cancer. After all, our thing says, no one should face cancer alone. Yeah? No one should face cancer alone. Finally, I will say, feel free. Feel free, enjoy the program, you stick around, stay engaged, and we will have some refreshments towards the end of the program. Thank you. Without further ado, I will ask for the next presenter to come. Thank you.
We are going to play a video. Please, we warn you, and we ask you to watch carefully, because in this video, you will get a lot of information. So, we ask you, please you pay your attention to this video. There are people who got the cancer in their lives, but they were able to fight it because maybe they love their lives, maybe they love their friends, their family members. That's why they fought the disease and they become okay. Please let us put our attention to this video.
Hi, my name is Sylvester, and here is my story. 11 years ago, my father was diagnosed with prostate cancer. At age 87, I'm pleased to say he is fit and healthy and enjoying all his usual activities. His diagnosis, though, highlighted to me that 1 in 4 black men will be diagnosed with prostate cancer. So, from then on, I made sure I got tested once a year. Until December 2020, my PSA test was high. A further test and scan showed I had prostate cancer. I did not have any symptoms. In my case, I was given a choice of radiotherapy or surgery, but it was suggested because of my good health and age, I would recover quicker from the surgery. This was done robotically, with 5 incisions in my abdomen. And yes, 5 weeks later, I was up and about, able to drive, and do gentle yoga. So I urge you, if you are age 45 and over, please go and see a GP. Know your risk. Cancer caught early can save your life in more ways than one.
During a consultation with a patient, Dr. Henry recalls the past. To that day, when the hen discovered a lump in the shower. As a medical student, Henry knew better than to panic right away. After all, a majority of breast lumps are benign. But after further self-examination, the hen began to suspect something. Henry immediately made an appointment with me for a consultation. Of course, it's understandable to feel anxious, but we'll find out more tomorrow. Henry came in for a series of diagnostic tests. I sent the sonogram to the radiologist, who noted an abnormal mass. Further exploration was deemed necessary, and Henry gave consent to this. The next step was a fine needle aspiration to remove some breast tissue. Henry seemed nervous, but fortunately, Nurse Kenya was assisting. 10 days later, the results were in. Unfortunately, I did not have good news to share with my student. The lump was malignant breast cancer. It's a difficult conversation, but once a treatment plan was discussed, Henry was ready to fight. Chemotherapy will begin shortly. It was Henry's first session. Nurse Kenya attached an IV to the chemo port. It was important for me to be there for my student. Treatment does take time, but Henry was determined to keep up with school. At the next session, Henry was feeling cold, which is not uncommon. It's always a big help to have the support of friends and loved ones. As treatment continued, hair loss and appetite changes were inevitable. But new friendships and sharing of experiences gave strength. Chemotherapy left Henry feeling fatigued and drained, but Henry was not alone and was able to rely on the thoughtfulness and kindness of friends and housemates. Henry's sessions have taken time, but they will be coming to an end soon. Henry arrived at the Henry Medical Center for yet another chemotherapy session. Nausea and hair loss are common side effects of chemotherapy, but many also experience others, like oral pain and mouth ulcers. Sucking on ice chips helps with some of the side effects. There was definitely excitement in the air, and a great sense of relief. I did make sure to be there for the last time. It hasn't been an easy time for Amber, and I wanted to remind my students that there's still so much more to accomplish. Finally, the day has arrived. Amber thinks about all the hard work it took to get here. It's graduation day at Penn University. At this tax ceremony, Amber! The moment Amber's name was called and the diploma presented, a roar of applause from Amber. We all knew how much that man had to go through to get to this day. Memories of that time hang in Dr. Amber's office. They serve as reminders that give strength to anyone who needs it. The journey is tough, but never give up on your dreams.
I think we need a louder hand clap than that. It's a video, but we still need to give it credit. So, thank you everyone. Good morning. I hope you're all doing well. And I hope you're all feeling empowered and encouraged by this important conversation we're having today. It's not hard. We don't talk about it every day. Matter of fact, people avoid it. But this is an issue that affects every single one of us, whether directly or indirectly. We have warriors amongst us here who have defeated this before. We have people who have loved ones who are going through this right now. And it's something that impacts every fabric of our society. So with that, I'd like to just acknowledge the presence of our guests today. We have the wonderful team from Andalusia Health Center. You're welcome. We also have our wonderful members from Internal Medical Center. We have members from Anfara, Juba Cycling Club, and our wonderful health contractors, Dr. Beyond Sports, amongst us here, as well as the Great Mount Medical Complex. My apologies if I haven't mentioned the rest, but thank you for gracing us with your presence today. Our next segment, we have a presentation on breast cancer, and it will be presented by two of our doctors from Andalusia, namely Dr. Mahmoud Jamal Al-Farash, our gynecology consultant. You're welcome. Dr. Hassan Hamdi from Akademi, plastic surgery and body contouring specialist. You're welcome. So you can take it on from here.
Hello everyone. I'm very happy to be here. My second time to visit this place. It is a very nice place. I'm very happy to be here. It's my third year to be in Juba. I like this place, this country, all people. We are trying to meet you every time we come. My pleasure now to introduce a new small lecture of breast cancer. It is very important because when I went on the internet, I saw that from 2000, the top ranked breast disease in Juba and South Sudan is a breast cancer. It's the top one. It's almost 26% of death in 2022. So it is very important to know what is the breast cancer, what is the causes, and how to prevent it. I will not talk about the medical issue, pathology, etiology. Our target in this topic is to what is introduced, what the causes of the breast cancer, and how to use in our service, in our life, to prevent to happen for us, which is very important. What is the breast cancer? Breast cancer is abnormal cells which grow through the breast. What is the cause of the breast cancer? Anyone know what is the exact cause? Till now, we don't know what is the cause of the breast cancer. Why this woman have a breast cancer and why this woman haven't no breast cancer. So till now, we don't know what's exactly the cause of the breast cancer. But they have some risk factors to increase the risk of incidence of breast cancer. And the most important point to know is that the breast cancer is not contagious. If any woman has a breast cancer, if another woman touches it, she will not infectious. So don't be afraid if you have a woman with breast cancer in your family, don't be make it isolated. No, you have to support her, you have to stand with her, you have to stay with her till finish her therapy. What is the risk factor for the breast cancer? The first cause is not having child or having a later in life. This we find it to marry later, or even when she married, she delayed pregnancy for 17 years. She delivered later in life. And the using of contraceptive pills. According to WHO, now, the using of contraceptive pills, it is stopped after 60 seconds. If you 37 years now, it is not allowed to take contraceptive pills. After this age, it is not allowed because it increases the risk of the breast cancer. Also, there is some women use hormonal therapy after menopause to improve the symptoms of hot flashes, of muscle ache. They take estrogen treatment. Of course, it improves these symptoms, but these symptoms will increase because it increases the risk of the breast cancer. The breastfeeding, it is good for prevention of breast cancer, but if used breast pump or another technique, it will not be good. Special habits like alcohol, lack of exercise, overweight, this is the most common cause of this breast cancer. There is uncertain risk factors, not true, but we have to be considered, like high-fat diet, pollution, tobacco smoking, night work, and silicone which use in breast implant, but this risk factor is not true. So what is the most symptoms? How do you feel that I have this silent cancer? The most important symptoms, the change in the size of the breast. If you notice that there is a change in the size, or the nipple inverted, or the size of the side, or there is a blood discharge from the nipple, or there is thickening of the breast tissue, or swelling, or something like body cells running in the breast, that means we have a problem in the breast. So what will she do after this? The first thing, you have to consult the doctor for physical examination. The physical examination she can do by herself or by doctor. If she can do it by herself, it is very easy technique. If she wants to examine her right breast, she will put right hand of her hand on it like this, and on the left hand, she will make it a right angle dipping action to move around her breast to feel it. And it's better to do it during shower because the tissue is more wetty and too easy to feel it. If you want to examine the right breast, I will, in the shower, put my hand, right hand like this, and the left hand, it would be like acute angle, would be sharp, dipping like this, not fine movement, not sharp movement, to feel like this, turn around with the breast. Then, when you feel around the breast, you move upward, inside the arm. If you feel anything, it means you have a problem. You want to examine the left breast, you will check the left hand like this, and the right hand also dipping to around one breast tissue, then upward to inside arm. This is the examination, you have to do it. And you have to learn your mother, your daughter, And it's better to do it after 30 years to examine yourself during shower. Another examination, there's mammogram, there's special X-ray, which uses to diagnose the cells, and we can use also ultrasound to high special, high frequent, and as you see the video before it, we use some types of biopsy, a small needle, we can insert here through the breast to aspirate some flow from the breast and to see if they have a malignant cell or not, which is the most accurate and the most diagnostic. I told you the first of this talk, the incidence of the breast cancer around South Sudan in 2022, it was 26%. Number one, the top cancer by death, which is very high incidence. And the second one is the cervix, 18.6. You go to the cervix on another day. So what is the treatment? The treatment of the breast cancer is now available and it is easier. We have a local treatment. We have just a local mass. We can remove it by surgery and follow up by chemotherapy or radiotherapy. Or if this spread, this cancer all over the body, in many cases, we have to use a chemotherapy and hormonal therapy. And there is a new modulation treatment, it's called radiological therapy, which is available. So, how to prevent cancer? If there is any vaccine, can the woman take it to prevent? Till now, there is no vaccine to take it to prevent the cancer. But we use some vaccines when the patient is infected. It's called tamoxifen or Novartis, which is very, very good because it decreases the progress of the disease and improves the quality of the treatment and the rapid recovery. Is there no option to prevent? Yeah, you have to be things to do to prevent cancer cervix, breast, to modify your lifestyle by just go for alcohol, try to a little alcohol, smoking, a little smoking, exercise of course. The most important thing in the world is your family history of the breast cancer. What do you mean of this? If you have a family history, your daughter, your mother, you have to check after 40 years, and some people say it's 75 years, at least 1 year of mammogram or of ultrasound. Because this disease, some people call it a genetic disease. So you have to check. If you have a breast family history, your mother, your daughter, she has to check every 1 year by just ultrasound or mammogram. Because if we find the stage in the early stage, it was very easy to treat it. You just only remove it and it's finished. But if it is advanced, she has to use surgical radiation plus chemotherapy, and the chemotherapy has a lot of side effects. Number 5 is also important about hormonal therapy. As I told you that the WHO now, after 57 years, it's better to not use the oral contraceptive pills. Never do it, especially if you have a family history. Even if you have a family history, after 37, you have to stop the hormonal therapy, the hormonal replacement, like contraceptive pills. You want to use, you can use a loop, Uganda, injection, but never use the oral contraceptive pills after 37 years. I told you how to check your breast every month, your shower, which is very easy. Maintain low fat diet, and I told you also, especially in family history posted, the mammogram is every 1 year after 40. The first things, try to many early and you try very early. And of course, concern of breastfeeding, which is better than formula feeding. My home message, the breast cancer, if it is diagnosed in the early, it will be very easy to treat it. And if diagnosed in the late, it also treated, but it will take a long trip of treatment like chemotherapy, radiotherapy, plus surgery. The chemotherapy has very serious side effects, depression, their fall, and anxiety all time, and weight loss. That's why we want to avoid to reach this stage. The diagnosis is very easy, but you have to check yourself by ultrasound, mammogram in 1 year, especially if you have a risk factor, and all causes I mentioned to be considered to have life and good health. Thank you so much. Any question? No? Oh, only question. Okay. I like the it's a mic, please.
Okay, thank you for your presentation. My question is on the risk factors. There was pregnancy and breastfeeding.
No, I say that the breastfeeding it is protected, but if used formula feeding or it is not used. Use breastfeeding and pregnancy. It is with, not against.
Okay,
Yeah,
thank you. That was all.
No, I put it in the risk factor. You need it a positive, not a negative.
Okay.
Yeah, it is supposed to use a breastfeeding and pregnancy.
So I was worried about.
I don't to bring too much detailed information. But the breast cancer is estrogen dependent. It depends on hormone estrogen, which is not present. This estrogen it is possible with the period. When you will have with a period, you will be pregnancy with lactation. So the pregnancy and lactation it is protecting you against breast cancer. That's why. No, it is a positive, not negative.
Thank you. I've also learned something new that the oral contraceptive
Yeah, it
is
is.
not good.
Yeah, you have to stop it after 57 days, as I told you.
ناس الورق ممكن زي العربي يا جماعه اي لغه تدرس عندهم ممكن
Arabic, English, French, you can. Germany, a little.
Thank you for the chance.
So,
I would like to ask, for example, if you have fibrobloma,
I what?
fibrobloma,
Fibrobloma, yeah.
yeah, is it possible to develop the cancer in case if the doctor thinks you do?
It's a good question. Look, I don't mention the medical classification of the breast cancer. We have a classification of breast cancer: grade 0, grade 1, grade 2, grade 3, grade 4. Every grade has a special treatment. It is not our goal, but fibromyalgia is classified as grade 0 or grade 1. So what is the follow-up of this? The grade 1 or grade 0, like fibromyalgia, just follow up after 6 months. Just follow up every 6 months by mammogram or by ultrasound. If she has a fibromyalgia, you have to follow up. But the risk, the incidence of breast cancer from fibromyalgia is than 5%, which is very low. But to have to consider, it's one of the stages. It is very benign condition, no problem about it. Just follow up by every 6 months. It can slide either grade 1 or grade 0, which is okay about it. It is like fibroid in the uterus, which is never terminal pregnancy. It terminal pregnancy in 5%, maximum 10%.
Okay, thank you.
You are welcome.
Okay, good morning.
Yes, sir.
After breast, self-examination,
Yeah.
and then I felt something in my breast. How can I differentiate between the tumor? If it is cancer or not cancer?
Okay, I told you the examination is not a sure for diagnosis. The sure for diagnosis is by mammogram or by fine needle aspiration. The examination just give you really have or haven't. If you feel my examination is something abnormal as I examine out of them, you have to consult. But it's not true because sometimes the breast is contain two things: the ductal gland and the breast tissue. The breast tissue which develop the breast cancer. The ductal gland which reduce the lactation, the milk. So if you have a problem in the breast, maybe one of the causes is inflammation of the ductal gland, like overproduction of milk, stretching of the ductal gland, which is okay, which can be treated by oral treatment, which is very easy. But I told you when you examine, you will start like this, you will start around the breast and moving upward to the arm. Because if it is only around the nipple, most probably it is like from ductal gland, which is a small condition, easy condition. But if it is spread and movable with your pill upward, so we have to be alert signs that you have to consult your doctor. Any question? Yeah.
ممكن أسأل سؤال؟ الكانسر relevant للمساوي برا ولا في مجال؟
أنا سمعت كنت في المشهد sorry. You are very far right. What is the question?
As she said, the breast cancer, is it for females alone or also men can be affected?
Unfortunately, if it was for them, male and female, but the highest is in female, about 89%, and the male 11% only. Only men all time are lucky. We are always lucky. But we have to know, the incidence, I told you, is breast cancer number 1, cancer cervix number 2, the second cancer is the cancer prostate, which happen in men. So we are not also insane. So it's our second cause of death is a cancer prostate, which is never happens in women. So you are recording this, don't worry.
Yes, thank you for the presentation. My question framed about the balanced diet.
About what?
Getting cancer could be related to one's diet. The question now is, in South Sudan, we appear to be risky nature, whereby the majority of the foods are produced without GMOs. I read an article, a diet that is related to GMOs, genetically modified organisms, which are foods basically, are risk factors for cancer. What can you tell us about this? About GMOs, genetically modified.
About genetics?
Yes, genetically modified. For example, I can inject a mango tree in 1 month, it already bears fruits and it has already grown and matured. What can we do about this? Because the majority of the foods are imports from our country.
Okay, it's a good question. I mentioned in one slide of the presentation, this one, look. The exact cause of the breast cancer are known till now. Till now, we don't know what is the cause of the breast cancer. There is some studies, some papers, say there may be a genetic cause, but it runs in mother, not in father. The genetics of the mother, like mother, her daughter, her grandmother, and so on. It is a study, it is not a show. It is some papers in correlated cases and define them. Most common cases have breast cancer, have family history. But why this have and didn't have, don't know till now. Till now, this time I hear, it is not now why it's happening here in genetic factor. Just to be considered, if they have a family history, your daughter, your grandmother, your mother, she has to be considered that maybe she has a high risk to have this. Why? This genetic factor, till now, no one don't know why, what is the cause. But to be considered to be follow up. But if any woman has her mother, grandmother has a history, old history of breast cancer, she has to be considered. She has at high risk, and she just follow up every 1 year by mammogram or by ultrasound. Any question? Thank you so much for this attendance, and I hope you get to visit more lectures. And I don't do that as the risk factors and prevention is the most important. And as I told you, the results, the leading cause cancer this is also that will be number 1 is the breast, number 2 cervix, number 3 cancer prostate for men. You have to be afraid also. So I hope you get benefit from this talk, and I hope you get rest, inshallah. We will be more talks about cancer cervix and another talk. Thank you so much.
Thank you very much. I think we need to give them another round of applause for all the movements and the efforts, including the outcomes of people who are suffering with breast cancer, especially, but all other forms of cancer. And on that note, our next segment will be a presentation on prostate cancer, and it will be presented to us by none other than our very own homegrown, lovely Dr. Sunday Simon Book, the Section Head of Health at the HSC Department. You're welcome.
Thank you so much, Kristen, for this beautiful introduction. Ladies and gentlemen, I'm very happy that everyone made it today. And most of all, let me acknowledge the presence of all our managers, our MC members, and the President Office. Thank you for coming today. All interior and all Andalusia Saha, and all the contractors within us, and all the staff of Dpoc. So the idea was only for breast cancer because this October is for breast cancer awareness. But since we are in this company with all of the same gender, male and female, we would like to give a short presentation regarding prostate cancers. So the objectives will be definition, causes and risk factors, signs and symptoms, benign prostatic hyperplasia, and diagnosis, prevention, and treatment. So when we come to the definition, okay, so we come to the definition. If we see the two photos, it reflects a normal prostate and enlarged prostate, whatever it's a cancer or not a cancer. So this is the normal prostate, and this is the enlarged. You can see the cells within the glands are enlarged, not the normal one. So in definition, it would be like the most common type of cancer characterized by uncontrolled growth of cells within the prostate gland, as we see at the photo. The shape is one shape, as we see, and it's connected through the urethra. So this is the urethra. So if the prostate is enlarged, that means the urethra will come squeeze inside. Not like the normal one, the urethra is within the normal shape of it. In South Sudan, prostate cancer rate is 0.49, which is not that much high regarding the other cancers within. And in the world, it's 59. It's 59% risk of the other type of cancers in the world. So if we see the signs and symptoms, okay, if we see the risk factors, we will start by family history. Whenever you have a brother, or you have a father, or anybody from your family who has been diagnosed with prostate cancer, you are possible to be having a prostate cancer. The same on the genetic mutation. The BRCA1 is the gene that defines that this person will be probably having a prostate cancer with time. The BRCA is the same genetic factor that present in the breast. So that means the breast and the prostate are similar in the genetic. So whenever also at your family, your mother or your sister or anybody from your family diagnosed with breast cancer, you as a male have to make sure also in your genes, you don't have that genes, and this is another risk factor to have prostate cancer. The age and race. Whenever you increase in age, that means you will be probably having a prostate cancer. So that means we expect the prostate cancer to be above 65 and on. The diet and obesity. Whatever type of foods you are eating, sometimes it can represent in changing the normal weight and the normal shape of the things coming to your body. So that means the diet represents an important thing for you to reflect and to be healthy. Smoking. Smoking reduces the amount of oxygen that your blood carries to your all organs. We know that the organs are nourished by blood, and the blood is oxygenated by the oxygen that's pumped through the lungs. So whenever you smoke, that means you're taking the nicotinic substance within your blood. So that nicotine will go and stores in the blood vessels, and that will make your blood vessels sick. So within time, those blood vessels will not be having enough oxygenated blood to nourish your organ. So that means not only the prostate, the other organs. So that means smoking is a high risk for everything. It's a high risk for diabetes, for hypertension, for cancer, for any type of other harmful things to the body. So let's try to think about this smoking and know that it's a risk factor for many of other diseases. The signs and symptoms, nocturia. Nocturia means waking up at night and having that sensation to go and urinate. يعني بالليل ما بتقدر تنوم، لازم تصحى من النوم وتقطع نومك so you go and urinate. This is nocturia. It's in this picture. So nocturia means انت لما تكون نايم لازم تصحى من النوم بالليل so you go and urinate. This is nocturia. Burning when urinating. So you have that sensation of burning when you are urinating. Blood in urine. Sometimes when it's become obstructive, sometimes when you go and urinate and you find a blood in your urine and erectile dysfunction. The other signs and symptoms. Number one, frequent urination. بالعربي الفريكوينت يورينيشن او urgency انت بعد مرات ممكن تلحق تمشي الحمام يعني بتحس انك مزنوق شديد بالعربي البسيط. But this is the urgency. So whenever you have prostate enlargement, you feel that urgency to urinate. And you have a poor bladder control, PBC. This poor bladder control is the same meaning of that first photo. It's so fast for you, also quick for you to go and use the washroom. And then there is a weak urine flow, especially at the beginning of the skin. أي زول بيكون عنده أبوه كبير في البيت عنده الحاجات دي بيكون عارف الكلام ده أكثر مننا. الزول ما بيقدر يعمل كنترول لليورين بتاعه، يعني ما بيسهل تعمل كنترول. ليه؟ لأن البروستات بتاعك كبير. واليورين بتاعك ممكن يرجع للكدني sometimes ويعمل لك complications ثانية. But it's not easy for you to control your bladder. That's why it's easy for you to urinate. And I'm sure we all have some people at our house or neighbors or some people we know having this kind of things. Sometimes dripping of urine or inability to empty completely. Once you finish urinating, you feel like there is still some urine there. So for us, increasing age, we have to know these symptoms so we know what are the risk things that will happen to us in the future. The next slide is how to diagnose prostate. There is a physical examination, there is a prostate specific antigen. This test is taken by blood. You go to the hospital, they took your blood and they screen this type of antigen. They will know the volume within. If the volume increases in normal range, which is more than 0.4, that means you are probably having an increase in the prostate specific antigen. And another type of diagnosis is biopsy. بيمشوا ذاته بيشيلوا الجلاند بيشيلوا منه قطعه بيقوموا يمشوا بيزرعوه or they take it and give it to the histopathologist to see the kind of cells within the tissue. And another thing is imaging or ultrasound. بتمشي عليه الدكتور بتعمل موجات صوتيه بيعملوا لك موجات صوتيه and then they see هل الحجم بتاع البروستات ده زايد ولا ما زايد. التريتمنت طيب قلنا ان في حاجه اسمها بروستيت بناين بروستيت هايبربليجيا. البناين ده الحميد. يعني اي زول لما عمره يكبر ممكن البروستيت بتاعته تكبر. ما معناته انت عندك بروستيت كبيره معناته عندك كانسر. فالبروستيت ممكن يكبر مع العمر. اي زول عمره من 50 لفوق ممكن يروح حاكم يمشي المستشفى ونقول له البروستيت بتاعتك كبيره. لكن this is related to age. It doesn't relate to في ورق في جسمك او في كانسر في البروستات بتاعتك. دي حاجه طبيعيه جدا within time. لو شفنا الصوره على اليمين في جسم الانسان بنشوف الكليه بالجبهتين، الاثنين اللي فوق دي الكليه، وتحت اليوريتا، ده توصل اليورين من الكدني للبلادر، بعدها اليوريثرا. البلادر هنا لو ده البلادر ده البروستات لو بقى لارج معناته اليوريثرا بقت صغيره. معناته البول لما يكون طالع عبر البلدة بيرجع، ليه؟ لأنه ما بيجي حتة يطلع بيه. فعشان كده معظم الناس اللي عندهم مشكلة في البروستاتا ممكن يوم من الأيام يجي مشكلة في الكلى. ليه؟ لأنه البول ما بيرجع، ما بيطلع، بيرجع راجع بيرجع للكلى. So that will affect your kidneys and that should affect your all blood flows to your normal organs. So this is a hypothetic hyperplasia which is not that risky. It's normal with age. واي دكتور كبير في العمر ابوه انت ممكن يجيب لنا hypothetic hyperplasia with age. It's normal. Treatment it depends. لو كان الموضوع ده ريسك فاكتور كنت جاب لك الموضوع ده انت معناته لو كنت بتعمل سموكي you stop the smoking or smoke cessation. لو انت مثلا كل مره وزنك كبير، كل مره قاعد تسمع او ما قاعد تعمل رياضه، it's good for you انك انت تعمل رياضه. it's good for you انك تحاول تقلل وزنك with time. والهيلث لايف ستايل، تاكل اكل صحي، تاكل فروتس، تاكل فيجيتابلز، بالذات الزول قاعد يكبر في العمر يحاول يكثر من الحاجات دي ويقول لك الحاجات اللي فيها دهون، فيها زيوت، فيها بهارات، والناس تحاول تاكل اكل هيلثي. لو بقى ادفانس الزول ممكن يشيل له البروستيت برا، زي ما عملنا في البريست، العلاج بتاع البريست اللي هو والبيبي احنا بنشيل البريست كله برا، وعند الناس كتار بنعرفهم شايلين البريست برا وذيس نورمال، الزول بيعيش حياته عاديه وما بيأثر في اي حاجه. The same on prostate. لو الدكتور قال لك انه your prostate is large and you need to do prostatectomy, this is a very normal procedure. You can just go with it to save your life. بدل ما انت تخليه لما عنده كانسر ويجي ينتشر في باقي جسمك كله. And then hormonal therapy. الكيموثيرابي او الراديوثيرابي اللي احنا عارفينه دي حاجات كلها بيعالجوا بيها الكانسر. Importance of screening. طيب في الهيلث دايما كنا عارفين الاتش ار معانا الليله الناس تمشي تعمل ميديكال تشيك اب. السكريننج يا جماعه مهم شديد. It's good انه ما تنتظر لما تبقى عيان عشان تمشي المستشفى. انت ممكن تبرمج زمنك يا جماعه انا كل بعد 3 شهور I'm going for check up. براقب نفسك تمشي المستشفى كل 3 شهور تمشي تعمل فحوصات. انت ليه السكريننج مهم كل 3 شهور مثلا تعمل لنفسك؟ ليه؟ To detect potential health disorder or disease in people who do not have any symptoms of disease. So that's me. انت لما تمشي المستشفى ممكن بالصدفه يقول عندك سكري. ليس للمرض صدق. بالصدفه ممكن يقول عندي سكري، انا مش في المستشفى غير عندي سكري، وانا اصلا ما عندي سكري. So this means the importance of the screening. تمشي المستشفى فيك اب انت حاسس انك كويس وهي حاجه حاسس بملاريا او تايفود. يمشوا مثلا يجيبوا عندك مرض ثاني غير الملاريا انت حاسس بها ملاريا. So it's good always انه زول يمشي المستشفى ويحاول يفحص بنفسه حتى لو ما حاسس انه عنده اي مرض ثاني. Early detection will give you more effective options of treatment. عشان ما تصل مرحلة بعيدة جدا من العلاج that's mean you have to detect early. So that's mean إنه كل ما أنت فحصت بدري كل ما يكون عندك فرص كثير للعلاج. يعني مثلا بدل ما تاخذ كيموثيرابي وبالتالي توصل للمراحل دي you can just مثلا take that tumor out. لو كانت في early stage you can just take the tumor out with the normal هيكون حاجة طبيعية وتقدر تلحق نفسك. لكن لما تمشي المستشفى متأخر وبعد ما تجي تعبان شديد ده سنينه لو مشغول عندك اي حاجه ثانيه انت محتاج تتعالج سريع. ليه؟ لان انت you will be having complications more than just treating the disease you have. And then it's relief anxiety and unnecessary precautions. دائما بالذات للناس اللي عندهم في الاسره زول عنده كانسر. في اسرته زول عنده كانسر هنا. Who has cancer from his family? Who already? Okay? Most of us حتى لو جيراننا بالنهاية ده زول بالعافية وعزيز علينا بدون عنده كانسر. So احنا معناته في الأسرة ده كلنا we have to go and do the necessary check-up عشان بعدين برضه ما يجينا نفس الكانسر. نمرة 4 then fix the control before life-threatening complications زي ما أنا قلت. الناس بتاعنا والأخيرة reduce treatment expenses. يا جماعة الكانسر علاجاته غالية شديد. يعني ما بستاهل الزول يدوش عشان يتعالج، فلازم تدخل طرف ثالث، تدخل اهلك، تدخل اصحابك، اللي يعمل لك فان ريزنج، وكذا تسال يجيب قروش، عشان تعالج الكانسر. So it's not it's very expensive. الدواء بتاع الكيموثيرابي ممكن يكون $200 ده السيشن الواحد. ده بدل من يكون محتاج دم مثلا. احنا بنوصل للنقطة الأخيرة زول بيكون عنده كانسر ويقولوا لك الزول ده دايرين يقولوا له ده نقلوا له ده، لكن اصلا الموضوع كان كانسر ما عشان داير يقولوا له ده. فلو كان في الاول الناس اللي جاب بيت المشكله كان شنو؟ ما كان بيوصل للمراحل اي حاجه بيجسمه هو فلاي يدوره من برا الى البلد. So these are the importance of screening, and honestly, it's good always to know your health. It's good always to تعرف النورمال الوضع بتاعك عشان لما يجي وضع ما طبيعي عليك تقدر تعرفه. So as a females, I'm happy from the presentation with our breast today. We cover all the important sessions, and most importantly, how to do the self-breast examination. احنا كنسوان مهم جدا نشجع اخواتنا نشجع امهاتنا بالذات العمر الطويل انه يعملوا self-breast examination. مهم جدا عشان تقدر تعرف البريست بتاعنا لما كان طبيعي كان كيف ولما يتغير كان كيف. So it's very important. Let's encourage our wives, let's encourage our sisters, let's encourage our mothers to do such important things just for their health. And thank you so much.
Thank you, Dr. Sunday. In the interest of time, we have a next segment on the quiz. And we can also be taking questions. I think we're limited to 3 questions. So if there are any questions from the audience, we've got a gentleman there. As my wonderful co-MC is making her way to that end, I also want to announce that over the next 3 days, starting today, there will be a physical examination for breast cancer, and it will be happening at the clinic. So it will be today after lunch, tomorrow, and the day after. And for the prostate cancer, if you do, or if you know someone who's having symptoms that was stated in the previous presentation, we wish to inform you that Dpoc Medical Center has a team dedicated to conducting screening for prostate cancer, and they're located in Jebel, that is adjacent to BMC Gardens. So they also have a branch that will be in roundabouts. بس نعمل announcement ده ثاني بالعربي سرطان الثدي. I think that's it, yeah? مش دكاترة؟ هيكون عندنا فحص عام لمدة 3 يوم. So الليلة بكرة وبعد بكرة ده لبريست كانسر، ده كانسر ثدي. هيكون في الكلينيك هنا. فبليز ما تخافوا ما تخجلوا. Please, women, all of us, encourage one another وللبيشنت اللي هناك وللبروستات. في Dpoc Medical Center عندهم team شغالين عشان يعملوا screening. So please don't wait until it's too late. Don't wait until it gets worse. Take that step today. Please, your question.
Thank you for presentation. Thank you for the awareness of cancer. My question is very simple and really direct to the insurance return. Sometimes someone go to the hospital to check all the diseases we might have in the future, and they deny us that we not to check the cancer, even other things. This one I think I currently myself, I don't know about others. If that one should be considered, I think it would be good for us. Thank you.
Any questions to the HR? Any questions to the HR? Anybody wanted to reply from the HR? HR. HR, Mr. Gillis. Let's give hands to Mr. Gillis.
Apparently, if I am not wrong, this is the first time that my team and I have now been told that there are some aspects of the screening that Britain does not allow. I am aware that there's been a regular screening for all our staff, especially most staff came from the field. They did all their screening, we did not get any report. What we can do, I would ask Mr. Cholo or any other person with similar sentiment to check on us at the HR department. A year back, he was out on leave. So it's like right now, we can pick it up from there and contact with them accordingly. Overall, as far as I could remember, I was in Nairobi at some point. I went to Nairobi Hospital and did a general check. I did a general check and nothing was, no exception was made. But there definitely could be some cases. So John, bring that up at the department, we'll see how to handle it. And any other person, of course, they did not see the show. Any other person, I know, I have only been here for about 6 months. There have been a lot of complaints raised about our medical cover, currently handled by Britam. But if you look at the number of complaints by the time we came in, and the numbers right now, there is a complete drop because we have been able to address some of these issues like one by one. I know there could still be a lot of other things. We encourage all of you to take note of all those and bring them to HR's attention directly and be able to respond to them. We also need to take note that the current cover will be coming to an end by March next year. We are currently doing a contracting strategy to identify either a new contractor or if the current contractor will qualify, we do not know yet. But we would want to listen as much as possible from the staff so that if there are considerations to be made or improvement in the ongoing cover, the next cover should be much better than the existing one. That's what we're looking at. So whatever information you have, whatever challenges you face, come and talk to my team. Yeah is there, tomorrow is there, Jacob, Luke is also there, the section head in charge of policy, and my office, is always open. You can always come and bring it on.
Thank you so much. Any other questions, please? لو في أي سؤال ثاني، لو في أي معلومة لا يعرفها. Thank you for this question. I think she means if the cancer is contagious. Absolutely 100%, cancer is not contagious. It's related. الكانسر ما مريض. يعني ما أنا لو عايزه في البيت عنده كانسر أنا هيعالجني. يعني ما زي ال HIV. ال HIV ممكن يعالجني لو في زول عنده HIV، لو اختلطت معه بأي نوع من أنواع الريسك فاكتور بتاعت الكانسر أو الطريقة اللي بيبيعوا ال HIV. الكانسر ما بيعالج. يعني أنا لو عندي كانسر I will fight my own for this. I will survive my own for this. So أنا ما هعالج زول ثاني بكانسر. ليه؟ لأن الكانسر ده عنده علاقة بالجينات. أنا كان في جيناتي عندي كانسر، معناته أنا عندي كانسر. لو ولدي أو بنتي عنده نفس الجينات حقتي، معناته ولدي أو بنتي هيجيو كانسر عشان كلام بتاع الجينات، ما عشان كلام بتاع أنا بعالجه. لو مثلا لو ده البريس انا باخد الكونتراسيبتيف بالحبوب بتاعت موانع الحمل دي، ما انا باخدها انا براعي. سو لو جاني اي كانسر هيجيني انا براعي، ما هيجي لزول ثاني. فاحنا لازم نعرف الحاجات اللي بتسبب الكانسر، الحبوب بتاعت موانع الحمل، السمن الكثير، الجينات، لو في زول في الاسره عنده السموكينج او السجاير، دي حاجات خاصه بالزول. They are individual based. So cancer is not contagious. And cancer ما بيعالج زول. You will leave the route for it. You will fight it alone. But you need the support من الناس الثانيين. So لو في زول عنده كانسر يا جماعة، إحنا ما معناته نخليهم عشان خايفين بس يعالجينا. بالعكس زول الكانسر ده محتاج دعم شديد. محتاج دعم معنوي شديد. لأن الموضوع ما سهل. الموضوع صعب شديد. الموضوع نفسيات ذات بكون تكون عارف إنه الكانسر ده أنا حقيقي أموت، أنا هموت، هخلي أولادي، هخلي عيالي. It's not easy. So cancer محتاج emotional support. محتاج زول يساعدك. حتى في الشغل لو يريد في زول عنده كانسر we need emotional support. في البيت we need emotional support. ما إلا نديه دروس عشان نجيب دواء ولا كده. لكن لو قلت له ساعد إنه you will be fine, all will be fine. نديه support يا جماعة. زول الكانسر محتاج دعم احنا ما نجري منه لانه ما بيعالج، بالعكس محتاج دعم شديد زول الكانسر. اي سؤال ثاني؟ I hope you are correct for this.
I have a small question. Okay. Actually, what I want to ask is like we are talking about the breast cancer and the prostate. And these two organs are the most sensitive organs in a human being. The most sensitive. Also, these two organs, we are not exposing them to sun. What about, do you think that there is any relation with exposure to sunlight with these two sensitive organs, or there is no any relation?
That's a very good question.
Because earlier when people go naked, this was not there. But nowadays, the way we dress, the way we keep everything, so this type of diseases is increasing. So I want to know the relationship between exposing them to sunlight and not exposure.
Okay, thank you for the question. He was asking about sunlight exposure as long as an organs they are covered. بيقول إنه هل الشمس أول تعرض للشمس بيقدر بيحمي من الكانسر بالذات في البريست وفي البروستيت ولا لا؟ And now we know the importance of sunlight and sun exposures. And the main importance of sunlight and sun exposure is vitamin D. Vitamin D, which is very important for skin and for calcium. فلو لاحظت شوفوا على السؤال أحيانا لما يكون صغير بيقولوا ده لازم يطلعوا الشمس. بالذات لو جاء مولود مثلا لونه غامق أو لونه فاتح شديد ضارب الشمس. So بيطلعوا الشمس اللي كانوا يقولوا بيقولوا لا خليه يضربوا شمس بدل. So he become to the normal color بتاع السكين بتاعه. وبرضه لما يقولوا الجنة لازم يمشي الشمس عشان يقدر يمتص جسمه أكبر كمية ممكن من السكين بتاعه فيتامين دي، لأنه فيتامين دي مكون أساسي للكالسيوم. الكالسيوم نحن ممكن نلقاه من اللبن، من البيض، من الحاجات الثانية غير الشمس. هسه لو لاحظتوا شوفوا على الصغار اللي بيكونوا ساكنين في الشجر بيقول لك الجنة ده لو قاعد في الشقة ما بيمشي سريع. الجنة لازم يطلع برا عشان يضربوا الشمس. This is the relationship between the sunlight and the other things of the body. The sunlight is only exclusive for vitamin D. Vitamin D, which is the main component of the calcium. So it doesn't have anything to do with the breast or the prostate. These two organs are hormonal independent. So الأورجنز independent بيعتمدوا على الهرمونات. أنت كجسم يعني الهرمونات في الجسم بتساعدك إنه الحاجات دي تكون functioning normal. يعني زي البروستات هرمون اسمه أندروجينز. الأندروجينز للمرأة بيمشي بيبقى بروجستيرون وللميل بيمشي بيبقى تستوستيرون. So these are hormonal independent. They are not related to the sun exposure. The only thing that is related to the sun exposure is vitamin D. Is there any سؤال ثاني؟ سؤال ثاني؟ سؤال ثاني؟ So, let me
just for the sake of time, we will be having like 5 quiz or a question just to see how you understand the session. I'm very happy for the attendance today. People are colorful with the pink and the blue. So this is how Dpoc should be. Whenever we call you, you come, we will interact and we will learn. Thank you. Without going, today no one talk about the theme, and we need to emphasize when we are going from here, we should know that the theme of this year for the cancer is no one should face the cancer alone, and it will be mentioned by our acting manager. So this is to be in our mind because we are African. When there is someone who is having cancer, what like he's going to die, we will leave him. Maybe we will leave him even in a one room, staying alone. Someone even in the morning, you will not come and say hi to him. This is totally a bad practice, and we should encourage that. We should support each other. The first question: what is the meaning of the ribbon we are wearing? Quickly. We are having a very good gift. What is the meaning of the ribbon we are wearing? Is it just for decoration, or there is a meaning of it? Please. Raise hand up.
Hello? Okay, Dr. Adut,
what I understand about the pink ribbon and the blue ribbon, they are the colors of the specific cancer. The pink is for the breast cancer, and the blue is for the prostate, and I know there are other colors like green for cervical cancer. So that is what I understand.
Again, and why? What does it mean? Why? Is it just a color for cancer, or there is a meaning for it? Stand behind her. She's behind us. She raised it.
The color of the ribbon signifies that we are standing in solidarity with the breast cancer patients, and so we are standing in solidarity. If you're wearing this, that means you support your raising our
Yes,
hands.
correct. You can come from receive your gift from it.
Morning. This is actually not a question, but it's an information we want you all to know about. It not have a specific reason or worldwide known why, but you have to know about it. It's going direct to the males. Prostate cancer, it's specific with some race or some people. And not country, but continent-wise. Anyone have information? Males, regarding prostate?
سؤالنا فقط اسمه يعطونه من الميل or female أو الرجال يعطوهم القاعدين يمسكوا بروستيت أكثر.
الكونتيننت.
هذا فوائدك؟
عملوا لكم واضح صح؟ بيختار بقى واضح.
I think it is somewhere in Africa.
Somewhere in Africa? Okay, it's right. Mainly, it's always male for African race. You don't know the black specific. If you're even American but you're black, you have high risk than the white. You don't know why, but the gene that for us black people have, that's why we can this. So thank you for your answer.
Okay, we are going well. The third cancer. Dr. Sunday talked a lot. How we prevent. At least 3, huh? The country is exclusion.
Okay. I'm not sure if no problem. Can I try?
Yeah, you try your
Yeah,
level
I'll try,
best.
but I don't remember. I think smoke cessation, we have to stop smoking, healthy food, eat out, and stop addictions.
Wow. Great.
It's better I got from the presentation and I don't know anything before this presentation.
That's great. Another?
Exercise. Stop smoking.
Another way of preventing cancer in which regular, it's the interval time. Regular testing. The three I can mention, one of them is on the guidance already
Thank
mentioned.
you. Thank
Then
you.
Is it excited?
The bill is already out. Thank you. Maybe you answer the next. This is the last question.
Yes.
Maybe you can answer.
Okay, tell us.
Actually, this one for all of us. Say if, God forbid, one of your spouse got cancer. If she's a female, she get breast or a male get prostate. What is your reaction? What are you going to do? We need to take action. This one will be many people to give us ideas so we can support each other and we know how we can face that challenge.
I'm giving the answer. If my wife, Sylvie, is the one having, I am going to be in close contact with her to support her, so that we can fight the cancer together. He will be no.
You can get another one. You will get your gift, but also because we need to interact and to support and get more information. Female.
Yeah, good morning, everyone. Actually, I'm so sorry to say this. I have my cousin who is sick with cancer. He's on this treatment in India. So my support, I used to talk to him like, he will be okay. Let him not give up in life. Nothing will happen to him. And living like family support and all that.
Thank you. Also, this is what also the family told us. We need to support. We need to support financial, we need to support in some motion, encouraging, because even giving successful stories like the one we saw, it's not that that's the end. There's a lot of people that went through the challenge. Support, they now pass that. But also we can hear from one of the managers and MCs how to support. Support is one of us.
Yeah, I will not be clear at this point because how the support we have already our insurance. If there is anything need support, we will go through that and support. Only that we can avoid to isolate someone if we have it. Feel at home with them because it's not confused where we are when we are out. That's what I can say. Thank you very much.
Ending of our session. Can we get?
You want to say sorry?
No, I have to express grateful to what you do for this, and also for the Texas Republic and the presentations. We are very good about. I just want to also express my experience. I know a lot in the country. I'm sick now for almost 6 months, or almost 1 year. But my support, although he's a direct brother, I do support him. But after the got the disease, what needs me to be around him, I increase the support financially, emotionally. The rest of school, I do try to do more than the way I used to do it. And I need to pay the result in the fight, and use something not only. So it's really
Thank you. Ending of the session, can we just rise for 5 seconds in solidarity with our families, our loved ones who they have cancer. Thank you.
Thank you, you may all be seated. There is one group that has been doing quite a bit of work in the background, helping HSC out to make this event what it is today. And this group is led by our one and only champion, woman rep, also known as the Iron Lady, lovely Miss Vida John. Please come up.
If this room is looking nice today, a lot of thanks goes back to her. So, thank you so much. You're welcome.
Yeah, I'm very glad to stand here. Good morning, ladies and gentlemen. First of all, it's observed. Today, as we gather to mark World Cancer Day, it is initial to reflect on the impact of cancer, what we can do to make a difference. The World Cancer Day 10, 2024 is Close the Care Gap, reminding us that each of us holding the power to influence change in the fighting of cancer. Cancer is affecting millions of lives globally. However, by understanding the disease, adopting health lifestyle, and spreading awareness, we can take steps towards reducing its impact. Empowering begins with knowledge. By learning about the causes of cancer, the importance of early detection, and significance of health lifestyle, we equip ourselves to make informed choice. This knowledge is not only for our benefit, but also to help others around us. As employee of Dpoc, Department of HSC, you have played a crucial role in raising awareness, engaging in activities, and promote health living and participate in discussion about cancer prevention can contribute significance. We appreciate your efforts or organize sessions to share knowledge. Your action can inspire positive change. Let us use the day as a platform to empower ourselves and those around us. Each one of us has a role to play in fighting against cancer, whether it is through raising awareness, supporting research initiatives, or simply being there for someone in need, as we have heard. Together we can make step towards future where the cancer is preventable, treatable, and defeated. Once again, thank you. Let us stand united in the battle against cancer. As it was mentioned here, I'm representative of Dam Women Charity Association. We are a small group here. We are just from our small salary. We are just contributing every monthly to support our community. I also want to ask our brother, if you can support us, you can also support our small community. We do a lot of things supporting our community. We don't ask you to join us so you can support a woman, but to support us. Thank you very much.
What is important really is early screening. And we must, honestly speaking, try to overcome some of our barriers, more so the cultural barriers. I know some of us men, to think about going to a doctor and to address so that they can examine us is something that doesn't click in our heads. But I think for the sake of our lives, for the sake of our dear ones, we have to take those decisions. Without further ado, I would now want to welcome our patron of the day, Mr. Isaac, who is our legal manager. Please rise as we come to take the podium. You're most welcome, Dr. Isaac.
Attendance is quite amazing.
manually. So I was expecting maybe half of this to be everywhere, but everybody is here. And then because then we will let you because it's not how there is. Most of them are not here, the rest are not here. So I'm here to close the workshop. In the beginning, we set up a lot of الشكر الكبير للديبارتمنت الهندسي قيادة بول وساندي all the team making this day very important like this. Let me recap quickly on the presentation. One, there are three basic things that I took in this presentation. Very important. Let me be random. In the presentation with the concept, take it into mood, prostate by Dr. Sandra. If you can listen carefully to the presentation, we think it's more or less like something that has no exceptions. No exceptions. Even if it's not genetic, but your lifestyle can also bring you cancer. But again, now, and there are three things that concludes. Number one, lifestyle, very important. Number two, exercise. And number three, regular checkup. I think though if you observe the three, it can help. Lifestyle, look at the punaki, how ajat mashrubat. Mashrubat, taban on the top is alcohol. Alcohol is too dangerous. And the smoking. Marama batal, you can take something but of less quantity and do it maybe not every day. In Maragada, I was listening to some women that were talking. And a certain lady was complaining about her husband because the husband is not drinking alcohol. So in Tabata, I was listening carefully. That Marazu, Ma said, you have some sort of Daragi, the very top. Okay. When the light comes, the light. Uma, I was so dumb, one color. So the racket, yeah, it should change. And you put the game, that's what the racket. Then you try to put your so Basama to relax, let you about it, you about how you do it, and you tell you to put answer, we should go again. So then I said that we racket is better. Well, I look at this woman. What are you going to do? Some human being is like that. Huh? Is like that. It's good to also have those time with your friends and colleagues, but you do it responsibly. You do it responsibly. Insan, Owaladu, Utumud. And nobody can avoid death. Nobody can avoid death. وراء الفقر الإنسان ثلاث درجات. According to me, since time immemorial in the history of human being, there will be a time for you to be born and time for you to die. And the test is in three things. Number one, death. What will I do? You lead, you can close, according to the Bible, we are given up to 120, right? According to the Bible, those who read the Bible, the Quran, human being, punishment act, you can go to 120. In the history of Barak. So, there you can die. No problem with the natural death. Even the body becomes so tired. When you die, people say that that's in peace. Because before you die, you were also suffering. So you rest in peace. You rest. You don't know how long this peace is forever. That's number one. The percentage that goes there to die this natural death, sometimes it's only 5% or 2%. In any given population, not a very rich there. The second death includes this. Something must kill you. Be a human being, be a disease like this, to be snakes, to be something of suffocation, not just to be moya, but a gas or anything. That's how also human beings die. And this to be moved with that, the percentage that die like this is above 70%. From 35 to 65. Very big number. The last one that kill human being is when you got frustrated, you don't like anything in this world, and then you decide to terminate your life for yourself by suicide. The display of a lot of people. No, I don't know. You can share later. Okay. The most important thing to do is to do preventive measures to protect yourself. Today's presentation by the doctors is very important for us. To prevent the problems that we can prevent. Not for us. The Ethiopia, people mentioned by the Ethiopia. The Ethiopia now has served many lives. To be very honest, there are people that are alive today because of Ethiopia. Physical exercise is very important. There are those who think that when they go to sauna or to steam baths, that is exercise. That is not exercise. It helps at some point, but not enough. The exercise that has an impact on your life is the exercise that the whole body participates, including aerobics, including running, including walking on the roads. These outdoors activities are very important. I mean, my brother did that sometimes I get him to running. Maybe 10, 15 laps. I think you go more than that. Another guy you are running with my daughter. And that is very important. So I recommend let us do physical exercise. Physical exercise is very important. Very important. Number two, eating is time. You're not there for a late. You eat at 10, 11, and you want to sleep. Actually, you put that partner. After abdomen. You will not digest. It can also cause problems. Some of blood circulation and the rest. You must have some regular time of eating is time that you should adapt. Zaman, tempat kerja di Madinah zaman they were not there. And as a time they don't know. Zaman not there for Marathon. Sabah, Umisa. In Madinah Zakat not there for Garadamar. To some people it is a must. That would Sabah, that would Nahar, that would Umisa. Sometimes it should not be a must. After Sabah, we should get a bonnet. What happened to Nahar? You wait for the evening. But again, you don't be a must. Lalu barat, dulu kabilu akal, sabah, punya akal berbeza, pada bisa, mana pula akal dah berbeza kok, dah benar ada mana. So sometimes the way you also regulate eating is right, is very important. Very important. So what can I say? My education, good my education. And I used to envy him. What is your secret in that? Every year you just do the same. They want Gala will not tell you the secrets. I insist. Second week, Gala will not. Third week, I insist. He insists back. I insist on. God, why do you want to know? Why do I want to know what you are doing? God, okay. Listen. No matter what that, the womb, the top of the leg, and whatever you are eating, don't get satisfied. So, God, yes. You want to know. God, how do you do this? God, when you are eating, as you are progressing, the moment you feel that you are about to satisfy, stop. Eat the food. Leave it just this. But when it's there, but you just leave it like that. You will have space. And the food will move. Sometimes I try, sometimes I have to know where I violate. So I'm requesting all of us also, we can also be adaptable to a situation. To live longer is very important. But sometimes in the get fit. You have to regulate your eating style, exercise, and the most important thing, as said by Comrade Guest, do a regular checkup if you can afford to do it. So my to say for people are young. Go to Massachusetts, even when you are not young, so that you do a regular checkup. So that you know your body, you know your status. Sometimes it's all the mission of safer. The test the HIV rate, mother. Just out of fear. Just out of fear. I just didn't want to do that mother rate. You could do malaria or typhoid or okay? But you do anything, no problem. How you will die later. It's good to know early so that you can also have a treatment. Later that matter is it has been a pleasure and we have learned a lot. So sometimes we do some exercise with what we have learned today. By the way, I check up every 6 months. Here between Sunday you are saying every 3 months, right? Maybe we need to adjust. We need to adjust instead of 6 now, I will do it every 3 months. And I will do this. I've never done this one. But I do the rest, this one I've never done. But I will also do it. I will also do it. Let us do it regularly, every 3 months, if we can afford. People of time go to the Sunday, because Mahmoud Makelim Dano, and the Gulu arthritis. I'm on your bubble arthritis. I am not of Alamin, arthritis will be charged. What I know, Alamin, cancer is charged. But again, globally is charged. But I don't know arthritis. Globally is 3 months. July. So why not July? I think you can do something. Yeah, you can do something. This lot of that is now killing many people. It's also killing many people. But it's something that can be treated. You go to hospital, check yourself, you don't have to get your injection, and you leave. As a free injection, what would you apply for? You also take that one. You know, if I tell you, like human beings sometimes they are so negligent, they are so, I mean, they have a lot of negligence to themselves. Don't bother out my good ayanish and not the dictator. So be curious to know and to treat yourself. Today, I think we are going to be given the para meetings certificates. But again, with this training, we deserve something also for ourselves. Up to this junction, I want to thank everybody, brothers from, you are from Egypt, right? For coming here and helping South Sudanese. Thank you for your help. For the site, you give Markham, and you continue to offer the services to the people. Thank you everyone for coming, and let us do what has been recommended by our powerful and knowledgeable doctors. Thank you very much.
Thank you very much, Dr. Isaac. And if there's anything that I can definitely take away from what our legal manager mentioned is we should all go. He'll start and he'll lead us and we'll follow. So as we come to the end of this wonderful event, I want to take a moment to truly express my gratitude to everyone who's made it this far. I know it's been quite a long sit down. And I'd also like to thank the HSCT for your wonderful efforts and our lovely guests from Ana Lucia, from Iteru, from Dr. Biar, and our other contractors. I think, guys, please don't leave yet. We have a few sessions. Dpoc, highly come back. As we wrap up, we have a photo session. So I'd like to call forward our managers and our honored guests. If you can just come to the front for a photo session. And it will be followed by a cake cutting session. If we can have our section heads come to the front as well for this photo op. Our managers, please, you can come to the stage. All section heads.
بعد ما المانجرز يصوروا مع الجهاز بتاعنا اللي هي الفورم والستاف يجي الصوره بعدها طوالي. Thank you very much.